Opioid overdose is now a nationwide epidemic that caused over 41,000 deaths in 2016 alone and affects millions of Americans, including Idahoans, every year. As an EMS responder, you can potentially save a life by giving an opioid reversal drug called Naloxone. Prescription opioids are drugs that are used to treat pain. Some common prescription opioids include hydrocodone, oxycodone, morphine, and methadone. Normally, these are prescribed by a doctor or other qualified healthcare provider. Yet there are also illegal opioids such as heroin. Opioids are very powerful and easy to misuse or abuse, which is why cases of opioid overdose are on the rise. This video will help you recognize the signs and symptoms of an opioid overdose and correctly administer the drug naloxone to potentially save a life. An opioid overdose can occur for many reasons, such as taking the drug by accident, interaction with other medications, a sudden increase in opioid dosage, or in some cases, deliberate misuse. People taking opioids can also overdose if they have ingested the wrong dose, misunderstood the directions on how to take the drug, if they start taking the opioid at the same dose after a long break because their body's tolerance to the drug has gone down, or if they have an underlying illness. When someone overdoses on an opioid, their breathing can slow or stop altogether, which may eventually lead to death. Suspect an opioid overdose if the person appears unconscious or barely conscious, they do not respond to a loud voice or prodding, they have slow or shallow breathing, or have stopped breathing completely. They're choking or sound like they're snoring or gurgling, their lips or fingernails are turning blue or gray, they have pinpoint pupils, or they're vomiting or foaming at the mouth. Naloxone, sometimes known as Narcan, can temporarily reverse the effects of an opioid overdose. When used early, it can help restore normal breathing. However, naloxone has no effect on non-opioid drugs that can also be involved in an overdose, such as benzodiazepines, alcohol, methamphetamines, or cocaine. Naloxone can be given using one of 3 different methods: injectable, intranasal, or intramuscular with an auto-injector. It is also available in a single-dose nasal spray. Before you approach any potential overdose case, be sure to review BLS guidelines first. Ensure your scene is safe, scan the room for used needles and/or other hazards. Call for police if the scene is unsafe. Next, perform a primary assessment using the ABCD approach and request additional help or a higher level of care if needed. Once you determine that the patient has a pulse and their respiratory rate is slow or inadequate, focus on managing their airway. Use a bag valve mask if necessary to support ventilations, and continue with the mask for at least 1 minute prior to giving any naloxone. Once you've completed the primary survey, obtain a complete set of vital signs, listen to breathing sounds, checked pulse oximetry and glucometry if within your scope, and checked the patient's pupils. The next step is to administer naloxone. To inject naloxone with a syringe, be sure to choose one with a needle at least 1 inch long. Open the cap of the naloxone vial, remove the cap on the needle, and insert the needle into the vial. With the vial upside down, pull back the plunger and draw a minimum of 0.4 milligrams of the drug. Keep in mind that the vial may contain only 1 dose, or it could contain more than 1, so be sure to measure carefully. With a syringe, naloxone is best injected into the upper arm, thigh, or buttock. Insert the needle at a 90-degree angle, through the clothing if necessary. Then push the plunger all the way down to inject the full dose. To give naloxone using the Luer Lock nasal atomizer, first screw the vial of naloxone into the needleless barrel syringe and attach the MAD device. Check the pre-filled vial to make sure it contains naloxone and that the fluid is clear, not cloudy. Place into the nostril and push in the vial, giving the patient 1 milligram, or half the vial, in each nostril. To give naloxone with an Evzio auto-injector, first select the auto-injector, use the enclosed alcohol wipe to prepare the skin, pull the red tag to activate the voice prompt.
To inject, place black end against outer thigh.
Then follow the instructions, injecting naloxone into the thigh, upper arm, or buttock. After you've administered naloxone, continue to monitor the patient and provide ventilation assistance. Consider giving an additional dose. After giving naloxone, the patient may experience acute opioid withdrawal symptoms that can include nausea, vomiting, restlessness, or irritability. They may also respond erratically and be combative. Reassess vital signs and check neurological status. If the patient remains unconscious or apneic, consider an additional dose, then continue ongoing resuscitative support. Now, let's review the steps you should take using naloxone to help an opioid overdose victim. The patient's airway, breathing, and circulation should be your priorities. If they don't have a pulse, begin CPR immediately. Note that naloxone does not have a role in the cardiac arrest patient. If the patient does have a pulse and they meet the criteria, your priority shifts to managing their airway. Prepare and administer the naloxone. Note the time the naloxone was administered. Continue to provide resuscitative support. If necessary, re-administer naloxone after 3 minutes. Finally, thoroughly document the case. Thank you for watching this video.